All right, so we left off our last piece of the lecture, reminding you of what a gingivectomy and the gingivoplasty are. Remember, gingivectomy is the removal of diseased tissue, and gingivoplasty is the reshaping and contouring of gingival tissues, healthy or diseased. Incisional surgery can also be termed a periodontal flap surgery or simply a flap surgery. Incisional surgery is performed when an excisional surgery is not indicated. So when this type of surgery is indicated, the dentist may perform a thorough scaling and root planing of the exposed root surfaces while the tissue has been flapped, and allows the practitioner to see those root surfaces and thoroughly clean those. It allows the doctor to move the flap sideways or laterally to cover root surfaces of an adjacent tooth, and it also allows the recontouring of underlying bone of the patient. So once the incisional surgery is completed, the flap is then closed and sutured into place, and the periodontal dressing is usually placed after that surgery has been performed. So here is a look at the incisional flap technique. So in here, the operator went with a scalpel and opened the soft tissue attachment. They then took a periosteal elevator that we learned about back in oral surgery and lifted that attachment. And now that we have the bone is exposed and the root surfaces are exposed, in this area here, there's a very deep pocket. The periodontist can then go in and file and perform curettage here, and then if you can see the irregularities of this bone, they can file that and smooth it and make it more regular and much easier for the patient to clean. This is post-operative. The tissue has been replaced and sutured back together so that the tissues can then reattach on the bone, and the sutures will be removed in probably 5 to 7 days. So there's a lot of sutures going on here, and this type of suture is a continuous mattress suture, and you can see how high up into the palate this process actually went. So this patient hopefully is very dedicated now to keeping their whole mouth clean and ready to become healthy, because they just invested a lot of time, money, and energy into this. And if they're not 100% on board with this treatment option, they are looking at having this done again. Osseous or bone surgery is a surgery that involves a modification of the supporting bone. This surgery is performed to eliminate pockets, to remove defects in the bone, and to also restore normal contours in the bone. There are two types of surgeries. One is osteoplasty, and the other is osteectomy. Each one requires surgical exposure of the bone, followed by recontouring with the use of a rotary diamonds or a bone chisel. Osteoplasty, or additive surgery, is where bone is contoured and reshaped. In addition to this, bone may be added either from a bone graft, which is taken from a bone donor site from one area and placing it into another, such as taking it from the hip or the retromolar pad or someplace elsewhere in the patient, or placement of bone substitute materials. This can be from a cadaver. It can be from bovine, which is a cow, or porcine, which is from a pig. These procedures are useful in some patients with bone defects caused by certain periodontal diseases. Osteectomy is a subtractive surgery. This is where bone is removed. This procedure is necessary when the patient has a large exostosis, which is a bony growth such as a tori on the buccal plate rather than on the lingual. For example, osteotomies is performed if a patient needs a denture and the bony growth would interfere with the comfort inside of their denture. Another procedure is called crown lengthening. That's designed to expose more tooth structure for the placement of a restoration such as a crown. Crown lengthening is becoming a common procedure for aesthetic anterior restorations, and surgical crown lengthening may involve the removal of soft tissue and alveolar bone. So in addition to aesthetics, indications for crown lengthening can also include a tooth that's fractured close to the gingival margin or the alveolar crest, or when the patient has subgingival caries. So here are a couple of radiographs where crown lengthening was indicated. This patient already had, looks like probably a crown placed, and they had some deep caries, so we would have to go in and remove some of this bone so that we had adequate biologic width, which means adequate space for the new restoration to sit so that it wouldn't impinge on the bone. It's a predictable means of making sure we know where that bone is going to heal. In this case, we had decay under this restoration that was under the level of the tissue, very close to the bone, so crown lengthening would need to be done here also if they were going to be placing a crown on that tooth as a final restoration. Here's what it looks like in the mouth. So we have the crown prep, and we took some of the bone away to see a very good picture of the margin now. And again, we can predict where that bone is going to heal now with that bone being removed. Soft tissue grafts, we have a couple of these. One's called a pedicle graft, which is used to remove gingiva from an adjacent tooth or edentulous area to a recipient site on another tooth. The pedicle graft is freed on 3 sides but remains attached on one side and retains its blood supply. Another type is called the free gingival soft tissue graft, which has a donor site that's located away from the grafted site. The blood supply in this case is not attached to the graft and depends on the recipient site. These typically have the donor site on the palate, and it is received more than usual on the mandibular arch. Indications for a pedicle graft is that it's the best use for a single site recession, for root coverage, and for also increasing the amount of attached gingiva the patient has. The most common site for the donor tissue for a free gingival soft tissue graft is the hard palate of the patient. So after the surgery, the periodontist will most likely prescribe an analgesic and possibly an antibiotic to the patient. Many periodontists recommend the use of an antibacterial rinse twice a day to help with plaque control. And that antibacterial rinse is typically going to incorporate chlorhexidine. So that mouthwash may also be used during the first week to freshen the mouth and also inhibit plaque formation during the early stages of healing. Post-operative instructions should be given to the patient to ease their discomfort and also promote their healing. The dressings that are used are called Perio packs, and they are used to hold the surgical flap in place. They're used to protect the newly forming tissues. They're used to minimize post-operative pain, infection, and hemorrhage. They are used to protect the surgical site from trauma during eating and drinking, and also to support mobile teeth during the healing process. The most commonly used Perio pack is ZOE dressing because it has that soothing eugenol in it for the exposed dentin and cementum. And there's also the non-eugenol dressings if patients have a sensitivity to eugenol. This ZOE dressing for patients may experience redness and burning or pain in the area of the dressing. ZOE dressings are supplied as a powder and liquid that are mixed before use. These materials may be mixed ahead of time, wrapped in wax paper, and frozen for future use. This type of material has a very slow set time, which allows for a longer working time. They set to a firm, heavy consistency and provide a good protection for tissues and flaps But remember, some patients are allergic to eugenol, and it should not be used on those patients. So here's a person mixing the paste and the powder and liquid to form a bandage for the surgical site. The non-eugenol dressings are becoming more widely used. As a periodontal dressing, they are supplied in tubes of a base and an accelerator. It's easier to mix in place, has a smoother surface for patient comfort, doesn't have a bad taste. It has a rapid setting time if exposed to warmer temperatures, but this type cannot be mixed in advance because the working time is shorter. Here is a look at the non-eugenol dressings, the base and the catalyst that you had mixed equal portions together on a paper pad and put it on the surgical site. There are some types of aesthetic and plastic periodontal surgeries. These are used to enhance the aesthetic appearance of the teeth and the tissues to appear natural and healthy. The relationship between periodontal health and the restoration of the teeth is critical. For restorations to be functional and aesthetic, the periodontium must also be healthy. For the periodontium to remain healthy, restorations must be properly designed and placed. Periodontal plastic surgery procedures are used to correct those defects in the shape, the position, or the amount of tissue that the patient has. When we use lasers in perio, the term laser is an acronym for light amplification by simulated emission of radiation. A laser beam is a highly concentrated beam of light, which uses the power of the beam to be adjusted to enable it to cut tissue, vaporize, or cauterize tissue. The use of lasers is a promising new technology in dentistry, and research has shown that it may lead to more widespread use of lasers in clinical dentistry as continuing to emerge and evolve. Lasers are used to remove tissue, tumors, and lesions. They are used to vaporize excess tissue as in gingivoplasty, gingivectomy, and also frenectomies. They are useful in the removal or reduction in hyperplastic tissue and also to control the bleeding of vascular lesions. There are several advantages of lasers. Incisions heal faster than incisions made with electrosurges and blades. There is a rapid control of bleeding or hemostasis. The surgical field is relatively dry. Opportunity for bloodborne contamination is reduced. Fewer traumas to adjacent tissue. Less post-surgical swelling, scarring, and pain. Some procedures can be performed more quickly, and patients who are afraid of surgery may accept this method more widely. We need to take precautions when we are using a laser to protect both the patient and us as dental staff. Any person who operates a laser or assists during laser operation must be thoroughly trained in the use of the powerful instrument. They need to wear shielded eyeglasses to protect the eyes of the staff and the patient. Instruments must be matte finish, not shiny, because reflective surfaces can reflect that laser energy. We have to have protection of non-target tissues. These tissues that are not treated with the laser should be shielded with the use of a wet gauze pack. And remember, high volume evacuation. The HVE should be used to draw off the plume or the cloud created when the tissue is vaporized. This plume should be considered infectious, which is why we need to use that HVE. We need to have signs in the office that indicates to patients that a laser is in operation and they should be using safety precautions if they are around the laser. Splinting is can be temporary or permanent stabilization of mobile periodontally involved teeth to immobilize excessively mobile teeth so that the patient can chew more comfortably, to stabilize the teeth, increasing their mobility, and to distribute the chewing forces over all the teeth in the arch equally. Here is a look at an acid etch splinting of these two lower incisors. Periodic maintenance recall.